Hi there, I'm Dr. Jim. Thank you for spending some time with me. I have a question that is the theme of my topic today. Is there a social stigma associated with COVID-19? Let me explain. It wasn't that long ago when healthcare professionals, first responders, and patients themselves were significantly socially stigmatized due to AIDS and HIV. Remember that? Today, there appears to be a new stigma associated with physicians, healthcare workers, nursing homes, and people who have been infected by COVID-19. A social stigma is a negative association between an individual or group of people who share similar characteristics or specific diseases or disorders. We label people, it's a stigma. We shouldn't, but it happens. For instance, schizophrenia is one such psychiatric disorder that has been highly stigmatized for decades. I'm not saying it's fair, it's not right, but it has been an issue in our society. When people are stigmatized, they are in fact labeled, stereotyped, treated differently, and are even discriminated against. COVID-19 is causing some social stigma due to its largely unknown origins, long-term effects, and its association with death, particularly if you are older or elderly. Many people are afraid of the unknown, and this virus has plenty of unknowns still. Stigma also tends to make people think in us versus them type of ways, unfortunately. We're healthy, and we don't want to be exposed to your illness, is the thinking of some individuals, and it's in the research, it's in the literature. So I'm not making this up, it's a thing. Such a stigma could have devastating and long-lasting impacts on people. People can become self-isolating, and I know a few. You might. They might become withdrawn from people they know, they love, or from society as a whole. Some individuals will put off health problems until the pandemic is over, which is really dangerous at times because it can lead to worsening of lots of conditions. Health issues may be kept secret and hidden from others to avoid discrimination. Thankfully, there are ways to combat COVID-19 stigma, and it starts with knowing the facts about the virus. Beating down any stereotype means you know the facts. We have to know how it spreads, what can be done to protect us, to protect other people. In this way, the infodemic, it's a play on words, I found it in research, can be slowed down or stopped altogether. Reach out to influential people in your community or online and ask them to educate the public on the truth versus myths around COVID-19. When there is information published somewhere, and there's a lot of bad information online, we know that, we might need to report it. I don't like to call people out. I don't like to be a watchdog or anything like that. But if there's really bad and dangerous information, maybe we should be looking into it. And be empathetic towards those who have been infected, have lost loved ones in particular, and those still working on the front lines in hospitals, nursing homes, and elsewhere. Health crises come and go, and they're going to continue to do so. It's our generation that is dealing with COVID-19. It seems like human nature to label a person or a group, though, who share similar health problems like substance abuse, HIV, AIDS, schizophrenia, and now COVID-19. Stigmatizing other people is simply unethical and immoral. It really is. With education and understanding, we can all defeat social stigma associated with this virus. So I'm Dr. Jim. I'm doing my part, and I encourage you to do yours. Thank you so much. Keep coming back for more information.